afternoon, everybody. Deli, how are you? We are here today for the swearing in of the Baltimore City Trauma Informed Care Task Force. This task force was mandated by the Elijah Cummings Healing City Act, sponsored by Councilman Z. Cohen. It's Councilman Burnett's birthday today. He gets all the claps, I guess. This law makes Baltimore the first major city in America to comprehensively legislate trauma-informed care, and I am honored to be the mayor who gets to implement it. One of the most untold stories of the ongoing violence epidemic is the trauma our residents, especially our young people, experience and internalize on a daily basis. Thus, addressing trauma is critical to prioritizing the lives of Baltimoreans. In just a moment, we will swear in the task force members. This group of 29 people are charged with developing a citywide strategy for reducing and addressing trauma in Baltimore City. I look forward to partnering with the task force as we center a trauma-informed care approach and fundamentally transform how our city agencies engage with residents. Last month, I committed that the members of my cabinet would undergo trauma-informed care training, and those trainings have happened. I also had the opportunity to be trained. This is not overnight work. I'm going to say that again. This is not overnight work, but it is necessary work. I'm ecstatic to be a part of this work and honored to swear in the inaugural task force. Councilman Cohen of the 1st District and Director Tisha Edwards of the Mayor's Office of Children and Family Success will serve as co-chairs of the task force. I also want to recognize Delegate Regina Boyce of the 43rd Legislative District and Councilwoman Odette Ramos of the 14th District, who will be sworn in today. Thank you all for your continued service and leadership. All right. I will now call up the first group of Trauma-Informed Care Task Force members to be sworn in. When your name is called, you're here. After we read the oath, you will sign your name in the book back into our right in front of City Hall.
Right. I'm back.
Hey, Shorty.
Let's see.
I was kidnapped by the state in February, Black History Month, 2011. Brandon Scott, Nick Mosby, Marilyn Mosby. I want justice and you won't get no peace. It's the art of protest.
When I say your name, just say your name.
I ain't got nothing to do with it.
Just say your name. I will call everybody in the first group. And what we'll do is, we'll do it like this, so there's no confusion. So the first group will be called up first. In the first group, we have the Honorable Regina Boyce, Erica Bridgeford, Teresa Bruce, Donna Bruce, Kevin Daniels, Elijah Davis Jr., Desiree Dixon, Tara Doty, and David Falcon Lee. And also Councilman Z. Cohen. Yeah, I saw him behind him. Thank you. All right. So when I say I, everybody say your name. I. There you go. We're going to go down the line here. We can go that line and back up here. This is what we're going to do. I.
Teresa Booth. I, Tara Doty. I, Erica Bridgeford.
Do swear. That I will support the Constitution of the United States. And that I will be faithful and bear true allegiance. To the state of Maryland. And support the Constitution and laws thereof. And that I will. To the best of my skill and judgment. Diligently and faithfully. Without partiality or prejudice. Execute the office of. Member of the Baltimore City Trauma Informed Care Task Force. According to the Constitution of Maryland. and the laws of Baltimore City.
and the laws of Baltimore City.
Congratulations.
Ladies and gentlemen, please follow this way. Silence, follow the deputy and the Group 2, please come forward. Group 2, please quickly come forward.
Group 2,
Councilwoman.
the Honorable Odette Ramos.
Sir.
Panagis Galasatos, Lindsey Gavin, Monica Vasquez, Lydell Hills, Mark Jews, Dr. Phil Leaf, and Brendan McFadden. Oh, yeah, sorry. And Director Edwards. All right, so you guys already know. Everybody raise your right hands. Turn this way, face me. Sorry, you guys. We'll go right down the line. I,
Odette Ramos. Tisha Edwards.
do swear
Do swear
that I will support the Constitution of the United States
that I will support the Constitution of the United States
and that I will
and that I will
be faithful and bear true allegiance
be faithful and bear true allegiance
to the state of Maryland
to the state of Maryland
and support the Constitution
and support the Constitution
and laws thereof,
and laws thereof,
and that I will,
and that I will,
to the best of my skill and judgment,
to the best of my skill and judgment,
diligently and faithfully,
diligently and faithfully,
without partiality or prejudice,
without partiality or prejudice,
execute the office of
execute the office of
member of the Baltimore City Trauma Informed Care Task Force,
member of the Baltimore City Trauma Informed Task Force,
according to the Constitution of Maryland
according to the Constitution of Maryland
and the laws of Baltimore City.
and the laws of Baltimore City.
Congratulations, everybody.
Thank you. Thank you.
Ladies and gentlemen, please walk this way around to the signage. Please make sure you keep socially distanced. Group 3, may I have you come forward?
All right, Group 3.
Hurry up, Mr. Witherspoon, please.
Oh, he's all right.
Hurry up. Mr. Witherspoon, hurry up. Right here. Hurry up, perfect. Stand right here.
What's up, man? All right, everybody, face this way, raise your right hand. I,
I, Daniel Parker.
do swear that I will support the Constitution of the United States and that I will be faithful and bear true allegiance to the state of Maryland and support the Constitution and laws thereof, and that I will, to the best of my skill and judgment, diligently and faithfully, without partiality or prejudice, execute the office of member of the Baltimore City Trauma Informed Care Task Force, according to the Constitution of Maryland and the laws of Baltimore City. Congratulations, everybody.
Ladies and gentlemen, please follow the ladies in the yellow coats.
Do you mind 1 second to talk to us? Just,
Thank you, everybody. We're going to have some remarks now. I'd like to now welcome Councilman Cohen to the podium for some remarks.
Go Baltimore. Good afternoon. Across Baltimore, there is a fierce urgency for the Trauma Informed Care Task Force to begin our work. We feel it in the streets and we see it in our homes. For each of the last 6 years, violence has claimed the lives of over 300 of our neighbors. We've lost several times that to overdose deaths. And COVID-19 has left a trail of devastation, not only measured by overcrowded ICUs, but by the toll it takes on our mental health as we see a rise in isolation, depression, and suicide. What we fail to realize is that when someone dies an unnatural death, it's not just that person who suffers. It's their family and our entire village. And despite multiple attempts to incarcerate our way out of our problems with crime and poverty, we cannot break the cycle until we address its root cause. Trauma fuels violence, and violence fuels trauma. Let's also be clear. When we talk about trauma in Baltimore, it is rooted in our city's legacy of white supremacy and systemic racism embedded in all of our institutions. Baltimore was a birthplace of redlining and racial housing covenants. We enacted one of the first and most sweeping ordinances in our nation to codify segregation in 1910. We fought a failed war on drugs, which became a war on black and brown neighborhoods. It is not just the trauma of violence that haunts us, it is the criminalization of our immigrant neighbors, who are called aliens by their own federal government. It is the underreported murder of our trans brothers, sisters, and siblings. And it is the toxic environmental racism that takes years off of lives through lead poisoning and blight. If we want different outcomes, then we need different policy. I'm proud to stand with a mayor who understands the interconnectedness of trauma and racial injustice, and who's willing to lead by example, not just tell his agencies to get trained, but take the first step and get trained himself. And as I watched Brandon Scott learning about trauma-informed care from community and our health department under a portrait of Frederick Douglass in the mayor's office, I knew that we had the right one for the job. This task force is a love letter to our city. I'm proud to be its co-chair. Our mandate is to fundamentally transform how we do business both inside and outside of government. We are tasked with developing and implementing a strategy to dramatically reduce trauma across Baltimore. We will work with all city agencies to respond effectively and provide compassionate service to the residents that live here. This task force is made up of physicians, beauticians, educators, elders, students, returning citizens, elected officials, and healers from all walks of life. It has leaders from Healing City, Ceasefire, Central Soul, Sage Wellness, Fight Blight Baltimore, Kindred Community Healing, the We Are Us Men's Movement, Wombworks, Youth Empowered Society, Morgan, Hopkins, Coppin, University of Maryland, and many more. It has the first ever Latina councilwoman, who I'm proud to call a colleague and a friend, in Odette Ramos. It has one of the best delegates in the entire game in Regina Boyce. This task force is Baltimore, and it is beautiful. Let me close by acknowledging someone who could not physically be here with us today, but whose spirit is smiling down on us. Elijah Cummings had a vision that we would confront childhood trauma with the full force of our convictions. While he was prosecuting President Trump in Washington, while his body was racked with pain from cancer, he called on us to do this work. We live in his legacy and in the legacy of the young people who asked us to enact this policy. Elijah told us to transform our pain into passion and our passion into purpose. He said that our children are the living messages we send to a future we will never see. Today, we begin to build that future. Thank you.
Thank you. We are now going to hear from a fabulous youth ambassador and healing youth ambassador in our city, young elder.
How y'all doing? So, like you said, my name is Young Elder. I'm 19 years old. I'm a Healing Youth Alliance ambassador. I'm a Heart Smiles Heartbeat. I'm a co-founder of my own business called Quarantine Delights. And as of today, I am a member of the Trauma Informed Care Task Force. I'm extremely excited and extremely honored to be here. But this act is long overdue. Trauma has been an issue in our city for years. And not just the word trauma, because I don't want you guys to just think it's just trauma. Nah. Police brutality, poverty, gun violence, abandonment in the homes, drug abuse, sexual abuse, all of these things are happening in our community. And that is why the Trauma-Informed Care Task Force is so important. See, there's a lot of love in Baltimore City. But with all of the trauma, it makes it really, really hard to find the love. So that's why we have all of these incredible healers on this team, so that we can dig deep and we can find the love in our city. Because if we can't get past the trauma, we won't be able to find the love. I remember speaking to the late Elijah Cummings, and he told me, "Young elder, do what you are passionate about." And this is what I'm passionate about. I'm passionate about digging as deep as I possibly can to help my community, and especially help the youth. There's not many youth leaders on this task force, but I am one of them. And it's an honor to be on here, because we really do need the youth perspective. The youth is our future. So with this legislation, I'm extremely excited to just say, this is where healing starts. This is where we can build a new city, and we can discover the love that's in our city. I'm sorry, y'all. I might be messing up a little bit because I didn't bring no paper, because I want y'all to know I'm being real. All of this is coming from my heart. I've experienced trauma firsthand, but my mother did everything that she could. Shout out to my mother, she over there. My mother did everything she could to make sure that I had the resources that I had. And even though I experienced trauma, she made sure that I went to therapy, made sure I had a great support system, made sure I was enrolled in organizations like Heart Smiles. But everybody in the city doesn't have access to those things. So that's why it's our job to once again dig deep and find those people. So everybody here, not just the people on the task force, have a responsibility. So if you know somebody that is falling, it's your responsibility to pick them up. Because once you pick them up, you give them the strength to go pick somebody else up. Thank you. That's where healing starts. But I'm not done. I'm going to spit a couple bars for y'all real fast. How I'm doing? I'm not doing well. Because I'm living in a system where we set up to fail. See, statistically, I'm supposed to be dead or in jail. But I took a different route and told them I'm going to prevail. See, I come from a city you can't go out after dark. Yeah, it's murder after murder, and I don't know where to start. And something has to change, because it's breaking my heart. Yeah, I'm looking for the piece of city falling apart. I say these babies killing babies. I'm like, how do we come to this? Then we post it on the gram. And somehow we numb to this. And something got to change. Because I've had enough of this, and we killing our own people. So now we can't run from it. Thank you so much, you guys. I love
y'all. Thank you, young elder. Who, if you guys didn't know, you know now. She also spits hot fire. Thank you. We will now hear from William Killebrew from our Baltimore City Health Department.
Good afternoon, Mayor Scott and everyone assembled today for this very special moment. My name is William Killebrew, Director for the Office of Youth and Trauma Services at the Baltimore City Health Department. On behalf of the Health Department and our leader, Dr. Letitia Gerasa, I would like to say a big thank you and congratulations to our task force members. My responsibility is to provide oversight for the Health Department's role in implementing the Healing City Act. I will begin by saying, however, that today marks a significant day toward the implementation of the Healing City Act as a fundamental part of the process of cultural shift from violence and trauma to healing for all Baltimoreans, not just some. The Health Department plays a critical role in the Healing City Act that focuses on the training of agencies in trauma-informed and healing-centered approaches. Additionally, the Health Department will work to provide ongoing technical assistance to support the transfer of skills from training into practices. The faculty will continue to consist of a blended approach with agencies and community-based organizations and experts at the forefront of trainings and TA toward a citywide cultural shift. A trauma-informed, healing-centered approach is an organizational cultural change process that addresses trauma and promotes healing in systems of care, schools, hospitals, and businesses, and is a movement. I repeat, and is a movement. Trauma and adversity are growing public health concerns that present barriers for communities and agencies and the individuals and families they serve and engage. Trauma-informed is the overarching level, what we consider the umbrella. It provides the filter for everything that we do and how we behave. Trauma sensitive is the way that the organization, our systems, and individuals respond to trauma and adversity. Being trauma sensitive requires individuals, organizations, and systems to look at all aspects of their interactions, policies, procedures, and physical environment, etc., for the potential of re-traumatization, and adjusts in a way that allows them to be responsive and sensitive to trauma histories. Trauma-specific refers to trauma-specific treatment interventions. Essentially, this requires, as a young elder said, a deeper dive for all of us over the course of the next few years and beyond. There are many individuals who have worked behind the scenes over the last year to support standing up the task force, who include our task force work group, our training and technical assistance faculty, and other staff that often go unseen, but are in the trenches. And so I want to say a special thank you to them, and of course Councilmember Cohen and Tisha Edwards, Director Edwards, for your hard work as co-chairs. And then I also want to take just a quick moment of personal reflection. My grandmother lived here in the 1950s for 5 years with her boyfriend then, and who's my grandfather. And my mother was born at Maryland University Hospital in the 1950s. She was abused as an infant, and my grandmother fled to Washington, D.C. to save their lives. 30 years later, my mother at 30 years old and my brother Tony at 12 years old were murdered in our family living room in the state of Maryland in Capitol Heights. As I watched those murders take place in our own family living room, it was a very disheartening moment for me. But I had to grow up, and my sisters and brothers had to grow up to try to navigate the world that we would live in after such a horrible event. Fast forward so many years later, here I am standing here in Baltimore City as an employee of the city. So I can tell you from my experience that employees actually experience trauma too. And that we are not alone, that it's not just about those people we're serving and those people we're engaging. This is really about all of us. This is our movement. This is about us. And so as an employee of the Baltimore City Health Department in this city, we're all in this together. And we will not let trauma win. When trauma dehumanizes us, we will bring humanity back into its space. And that is what the task force has done today. And we're proud to be a part of the work that's happening today.
Thank you. We will hear now from Director Tisha Edwards, and let me say happy belated birthday to the director as well. Director Edwards.
You know way too much. Wow. What a wonderful day for Baltimore. I mean, we really need to take in what's happening in this very moment. How we are all coming together, rooted in love and a commitment to healing. I just want to acknowledge Mayor Brandon Scott and his leadership. he has always said that the cure for violence is love, and that we needed to have a comprehensive approach to making our city a place where children can grow and families can thrive. And I cannot personally thank him enough for his courage and his leadership, because there were so many days when he stood alone talking about this issue. And so thank you, Mayor Scott, for your leadership. And I also need to acknowledge Councilman Cohen, who had the foresight and the passion to really help us to operationalize something that no one else has ever done. I am so proud to stand with Mayor Scott and Councilman Cohen and all of the task force members to lead the work of healing Baltimore. And to Young Elder, you are amazing. We cannot do this without you and your passion and your commitment and your voice. You represent Baltimore's youth so well. I bow down to you. I'm inspired by you. And I'm so encouraged that I'm going to have the opportunity to learn from you, Young Elder. You know, it is our youth that has helped us to realize the negative impact that trauma has had on their possibilities and their potential. Today marks an important step forward for Baltimore. You, the members of the Trauma-Informed Care Task Force, are formally assuming new roles, which will put our city on the path of healing and building resiliency. A year ago this month, the City Council passed the Elijah Cummings Healing City Act, which in March 2020 became law. This happened largely thanks to the leadership of Councilman Cohen, a friend and critical partner of the Mayor's Office of Children and Family Success, and our shared work to improve life outcomes for Baltimore's children and youth. I am so honored to co-chair this task force with Councilman Cohen and to serve with all of you. Together, in the months ahead, we will lead Baltimore to adopt trauma-informed policies and best practices and to become a city that heals. Baltimoreans endure disproportionate and unacceptable levels of trauma. Traumatic childhood events happen at higher rates in low-income communities of color. Baltimore is more than 70% Black and brown, and more than 50% of our residents live in poverty. 42% of our children experience traumatic events before they reach adulthood. These two data points must be at the forefront of everything we do. If we are to engage in meaningful ways with and support one another, we must consider each other's experiences. When our children do something unexpected, we must not ask, "What's wrong with you?" but "What happened to you?" I think that's what Elijah said to us the last time we were together as a group, talking about trauma-informed care. I know this task force will hold us up to that and keep us accountable to the law we are charged with implementing. Collectively, this task force brings together the gifts of youth perspective and truth, mentorship, a commitment to equity, a trauma-informed lens, clinical experience, and an unrelenting love for our city and our children. Thank you for taking on this awesome responsibility and commitment, and I look forward to learning from and collaborating with all of my peers in the Trauma-Informed Task Force. Thank you.
Thank you, and thank you all for being here. I look forward to your partnership. Baltimore, not only can we do this, we will do this, and we will do it together. Thank you, and we'll take a few questions. No questions? Oh. We can't hear you.
On this day, when you're talking about trauma, which is a very good thing
Yep.
to address the city, a 16-year-old was shot in the head, killed this morning. What part of your crime plan, Mr. Mayor, is
So,
not working?
Keith, let me just tell you this first. We should have some respect for a young person that died today and allow that family to, and for us to find out what happened. What I would tell you is, knowing you very well, when we find out what happened with this young man, we will do everything necessary. But we have to be very sensitive, especially on this day. And I was hoping that we get questions about this, that we understand that this young man just died. We don't even know if all of his family members know that he's no longer here. And we have to talk about how we're going to do things in decency and in order. This is not about trying to solve, as you heard me say earlier today, this is not overnight work. This is work that's going to take a lot of effort, and we will continue to push to make sure that less people are dying in the city. Next question.
Absolutely. Not with that. This case notwithstanding. It seems
Next
that-
question. You ask your question. Who's next?
You mean another person?
Yeah, she's standing right next to you.
She's with me.
Anybody else other than their station?
Different question.
Yeah, go ahead. Ask it now. We'll make the, yep, we will make those, we give 4 weeks, we'll make the announcement this week, and be sure to make sure you guys know when we're gonna do it. Thank you, everybody. So the task force itself will have reports and things that they put out. Will show like who's been able to get the training and all the things that are offered, but they'll be developing more robust things on how we're going to make sure the implementation is widespread throughout the city. Thank you.